Hello. Have you ever wondered if daily activities like getting dressed, writing your name, or brushing your teeth suddenly became difficult or impossible? For a lot of people, that's a daily reality that they live. Thankfully, there is a career field called occupational therapy that helps with those daily activities. Today, I will talk about the history, issues, resources, and current events in occupational therapy. Occupational therapy is also known as OT and may be referred to as OT throughout the speech. According to St. Catherine University, OT started in the 16 and 1700s with mental illnesses. People with mental illnesses were treated poorly and were thought to be unsafe. Then, in the 1800s, they started to treat mental illnesses with sewing, gardening, listening to music, and arts and crafts, which then led to OT as we know today. Founders of occupational therapy are William Rush Dutton Jr. He started the National Society for OT. Susan Tracy, she wrote the first book on occupational therapy, and Eleanor Clark Slagle, she started the first school. People may not think about issues throughout this major, but in fact there are. According to the U.S. Bureau of Labor of Statistics, therapists will have to lift patients, be in awkward positions, and transfer patients, which then may lead the patient and the therapist to have injuries. Another issue that people may face in this field are bodily fluids, like blood, puke, and other bodily fluids. But thankfully there are resources to help with these issues. Some resources that I found researching this field are the American OT Association. On that website, you will find exam prep because you will need a license for this major, some OT pride swag like shirts and pins, but on a more serious note, there are publications and articles about OT. When searching OT, the most common one that will pop up is the Cleveland Clinic. The Cleveland Clinic is a site for the patients when you search up occupational therapy. On that website, you will find out what OT is, the risks and benefits, the recovery, and if they need a doctor. Moving on to current events, according to the Baker College, a current trend is AI. AI is everywhere and in every field and will affect this field. AI may impact occupational therapy with powered rehab devices and tools to help train the brain, like using and improving better memory and increasing attention span. As you've heard throughout the speech, the history of OT started in the 1600s with mental illnesses. And just like in any profession, there are some issues, like getting hurt and bodily fluids. Thankfully, there are resources like the AOTA and Cleveland Clinic. A current event that I discussed is AI to help rehab devices and improve attention span and better memory. The field of occupational therapy looks promising and really interesting to look into, and I'm excited to look into the field and possibly join that field. Thank you for your time.